Hi guys, I'm Brad Berg. I'm the medical director of Baylor Scott and White in Round Rock, Texas. And I hear that you guys have some questions regarding the coronavirus epidemic that's going around in Austin and around the world. I have to say, first off, these questions that you sent in are incredible. These are the questions that all the kids are asking me in clinic, they're what all the parents are asking, and they're quite frankly some of the questions that the smartest minds in the world are asking. And we don't have answers to all of them, but I'll give you the information that we have so far and go from there. Hopefully it'll give you a little bit of input on what's going on. So first off, what does COVID-19 stand for? COVID-19 stands for coronavirus 19 from 2019. So the coronavirus was first discovered in December of 2019, and they put a name on it for which is coronavirus, vid, which is virus, and then 19, which is 2019, and then just shortened it down to COVID-19. It's now considered SARS-2, which is a coronavirus that causes SARS, which is an acute respiratory disease, and it's the second one that we found. So the first one was SARS-1, which was from the early 2000s, which we found in China, and it died out pretty quickly. It didn't actually go around the world like COVID-19 is doing. We don't actually know where the virus came from. The first area that COVID was found was in one of the provinces of China, and it's thought that it lived in bats or another animal called a pangolin that people eat for food in Asia, and it somehow jumped from bats and pangolins into the human population, and then from there it mutated and became able to jump from person to person. And so once that happens, it can start spreading through a community, and then it took off from there and spread around the world. The more data we get, the more it looks like it's been around for longer than December of 2019, probably back in September, October, and it may have even started somewhere else, and it really just didn't take off till it got to Wuhan, China. But right now, that's probably about as good of a story as anybody has. Why is the virus here? Pretty much what I just said. There's viruses that live in animals and humans around the world, and a lot of those viruses only stay in humans, and they go from human to human like the common cold. There's other viruses that stay in certain animal species and go from animal to animal. And then there's, every once in a while, a virus will obtain the ability to jump from one host to another host. So so for coronavirus, it was growing in bats and pangolins and probably not causing any disease and just kind of living within that community. But at some point, it decided to jump into humans, and when it jumped into humans, then it started causing problems. And this happens from time to time and is a fairly common way. So like the influenza virus that we get every year, that came from chickens. And then sometimes it comes from pigs as well. So when you hear the swine flu came from pigs. And so this is a pretty common way for viruses to pop up. Could we see more diseases like this each year? Absolutely. I mean, just as I said, viruses are constantly popping up as we invade into places that we haven't been before. So cut down rainforests or move into parts of the world where humans haven't been before. We can encounter novel viruses that are living in animal populations within those forests, and they can jump into humans. Sometimes it can be viruses that have been in the pigs or the chickens or the animals that people are around, and they just have the ability to jump into a new human host. What makes COVID-19 so serious right now is it's a brand new type of virus that the entire human population has never seen before. So none of us have any antibodies against COVID-19. And antibodies are those things in your body that protect you from disease, and they allow your body to fight disease. And so basically nobody is immune to COVID-19. And so it becomes a lot more severe because everybody can catch it. And so most of the time, what we see with viruses is they're little mutations in viruses that we've already seen. So we already have a little bit of immunity to it just from being exposed to other viruses that are similar. But in this situation, we don't. Most of the time, COVID-19 doesn't cause any problems at all. So about 50% of the time, people will catch COVID, they become immune to it, and it goes away, and they never have any symptoms at all. The about 40, 45, 49%, depending on the age group, will catch COVID-19, and they get a cold, they get like the flu, so they'll have a fever, body aches, headaches, coughing, congestion, maybe some diarrhea. And after a week or so, it goes away just like any other virus that I'm sure most of you have had something similar to that. And it goes away, and then that's it. And it's over and done with, and everything's back to normal. A very small proportion of people tend to get really sick, and then they may need to be in the hospital. And some of those people do end up dying, and you see that in the news. I'm sure all of you have heard of that. But it's a very small proportion of the overall number of people who catch it. And one of you asked who is at the greatest risk of getting this, and then also, is it more dangerous for my grandparents to get than my parents? And the question to that is, yes, the older people seem to be getting it worse and seem to be having more complications for it. Also, people who have other diseases and medical conditions tend to get sicker as well. So people who have diabetes, who are overweight, who have heart disease, those people all tend to get sicker. So it's really important to try to keep those people well and try to keep those people protected so that they don't get it. And a lot of what you see going on right now with people wearing masks, staying at home, trying to stay out of groups, is to protect people from carrying it to the high-risk population. So a lot of kids don't have a problem with COVID, and I'll talk about that in a few minutes. But the kids tend to get COVID. They don't have a lot of symptoms. Just once in a while, a child gets really sick. And the vast majority of kids under 20 years old have really had no significant illness with COVID at all. Our concern is that those kids will take it home to the grandparents and get their grandparents sick, or get their parents who may be ill sick. And so we're really trying to keep the kids healthy so that they keep the rest of the family healthy. And I think that's really important. What is the chance of a kid in Austin, Texas getting COVID-19? It's, about the same as anything else. There's not a huge amount out there right now, so it's hard to know, because a lot of people who are positive for COVID-19 may actually not know that they're positive because they haven't been tested, because 50% of people, like I said, don't have any symptoms. So if you don't have any symptoms, then you're probably not going to go to the doctor and get tested. And so we really don't know how many people out there are positive right now. The one thing I can tell you is, as a kid, you're probably not going to get sick from it. Again, a fraction of a percent of kids actually get sick from COVID-19. So even if you pick it up, you're probably going to have no symptoms at all, or at most you're going to get a little head cold. So that's just something to think about. My dad was quarantined because he had the virus, but he's not quarantined anymore. What happened to the virus? Is it still in his body? Well, the virus, what happened was he got it. His immune system kicked in. It saw the virus. His immune system kicked in and took care of it. and then knocked it out, and it basically killed off the virus in his body. And now the virus is gone, and he now has antibodies to it, so that hopefully he's a little bit immune. And somebody asked, if I get it, will I always be in my body? And can someone who had the virus get it again? And those are questions we don't know. We know that when people get sick from it, they create antibodies, but we don't know what those antibodies mean right now. So some of you may be hearing about the antibody test and know that that when somebody gets tested, they end up getting they can go get a test. When somebody thinks that they might have had COVID, they can go get a test. And if they go get the test and it's positive for antibodies, that means they were exposed to COVID. What we don't know is whether or not that person could ever get COVID again, or maybe they're immune for the next 6 months, but after 6 months they can get it, or maybe they're immune for 2 years, but after 2 years they can get it again. Those are questions that a lot of scientists around the world are trying to figure out right now, and we just don't have that data. I'm hoping that by over the next 2, 3, 4 months, by the time everybody kind of gets back to school and the fall comes around, we'll have a lot more of that information, because that would be really helpful to know who might be immune and who's not. And right now we just don't have that. If one person is sick in a family, can others get sick? Yep. It's just like a cold or a stomach bug. It can definitely spread through a family. So that's why it's really important, if you're coughing, or if somebody in your family is coughing or sneezing, you always cover your mouth and your nose like this and cough into your elbow, not down like this. I see kids all the time going, that just sprays it over the top of their arm. So make sure your arm is right over the top of your mouth and your nose, so that you can really block that cough. When you cough, there's little particles from your mouth and spit that goes about 10 or 12 feet in front of you. And so making sure you cover that keeps that from spraying all over the people who are around you and potentially getting them sick. So you're protecting them by covering up your mouth like that and coughing into your elbow. And then the other thing to protect yourself is to wash your hands all the time. A lot of diseases, stomach viruses, cold viruses, they live on surfaces, and you touch a doorknob or you pick something up and you get it on your hands, and then you go and you eat your sandwich for lunch and it's on your fingers and it gets into the bread, and then you eat it, and that goes right into your body and then gets you sick as well. So really important to use hand sanitizer all day long, wash your hands all day long. And one thing that I've been seeing a lot more of over the last couple of months is people with really dry, chapped skin, almost like chapped lips. And it's because they're washing their hands so much, their hands are getting dried out. So if you are washing your hands a lot, which you should be, make sure you always put lotion on afterwards, just to keep your hands moist. Otherwise, they can get pretty dry and cracked and not feel so great. Let's see. How do we fix it? That is a good question. In the short term, what we're trying to fix is how fast the virus spreads. So some of you might have seen that in New York City, the virus spread really fast, and it kind of overwhelmed the hospitals, and the hospitals didn't have enough beds for people, and they were really trying hard to take care of the people who got sick. And we don't want that happening in other places. So by wearing masks, by staying 6 feet away from people, by keeping the groups of people that we're associated with in smaller groups, we're preventing that spread from happening too fast, so that if somebody does get sick and they do need to get into the hospital, they'll actually have the ability to have a bed and be able to be taken care of in the best possible way. Long term, what we're trying to do is develop a vaccine for the virus. And most, if not all of you, have been immunized to chicken pox and mumps, measles, rubella, and you had all those shots when you were a little kid. And if you're older, when in 6th or 7th grade, you had another 3 shots, or 2 or 3 shots. Those are all vaccines to various diseases that are out in our communities and that can make you ill. And so what scientists right now are trying to do all around the world is to develop a vaccine which would be effective, which you would take a shot just like you do for all your other childhood vaccines, or for the flu vaccine in the fall, for example, and it would protect you from getting coronavirus. And it may be a one-time shot. It might be 2 doses that give you immunity for a long time. It may be like the flu, where you have to take it every fall in order to stay protected. We just don't know that answer either, because we don't have a vaccine yet that tells us what the rules are. So what we're waiting for now is for the scientists to kind of figure out what there is out there, or what kind of a vaccine that they can make. And they're actually trying some novel scientific ways to make a vaccine that have never been used for a vaccine before. And so we're just kind of waiting right now to see what that looks like. And so hopefully in the next 6 to 12 months, we'll have a good idea about what a vaccine looks like, how many shots you need to take to become immune to COVID, and then when the vaccine is going to be available. Because one thing, once they find a vaccine that they think works, they then have to test it in a bunch of people to make sure it's safe. And then once they know it's safe, then they have to test it in a bunch of people to find out whether or not it actually prevents COVID, because what works in a laboratory doesn't necessarily work in a human. And then once they find out that it really does work, they got to get all that manufacturing and processing up to make billions of doses to ship around the world. And that just takes time. So it's not something that we're going to have tomorrow or next week, but hopefully sometime next year we'll be able to see a vaccine come out, and then we'll all be able to kind of go back to more normal lives like we had before COVID. Another question that somebody had is, when will it be safe for us to go back to school in the fall, and can I go swimming again? Everybody wants to go swimming. I think swimming is probably fine. Going to a swimming pool, if you're staying with your if you're a family pool, totally fine. If you're going to a public pool, you want to still kind of maintain those same boundaries. So stay away from a lot of other people in the pool. Try to stay 6 feet away from people. If you're outside the pool and you're at some place like one of the big water parks, wear your mask when you're out of the pool. When you're going to the bathroom, wear your mask. When you're going to the concession stand, wear your mask. And then just try to keep that social distancing while you're at the pool. Going back to school is a good question, and the school districts right now are really struggling with that. They're trying to figure out ways to keep the desks all 6 feet apart, which is hard because they have so many students that they have to teach. But they also know that staying at home and homeschooling isn't great either, because you guys want to be around your friends and you want to go play and talk to your friends, and that's really important for everybody, and especially for kids. The one thing that we do know is that we haven't seen any outbreaks of COVID in schools that have reopened, in daycare centers, in summer camps. That may change over the summer, but right now it doesn't look like we're seeing big outbreaks of COVID in situations where students are together. And that probably goes back to what I said at the beginning, that children don't seem to have a lot of symptoms. They don't seem to be catching it very much. We've tested a lot of kids in my pediatric practice over the last 3 months, and we've only had 1 positive. So again, that may be a sign that kids just don't pick it up for whatever reason. And again, over the next 2-3 months, I think that we're going to be getting a lot more information and a lot more ability to know the answers to that. Do we need to keep kids 6 feet apart? Does it matter? Do you have to wear a mask at school, or can you take your mask off? Is there enough people who already have caught it that they'll protect some of the kids in the class from each other? Those are all questions which will get worked out over the summertime. And all the school districts will have a plan in place where they can try to make it work. It may be a little bit different next year, whether or not there's big sports competitions, whether or not you have 25, 30 kids in a classroom. I don't have an answer to that, and I don't think anybody does right now. So we'll kind of wait and see. I'm pretty sure that schools are going to open, and the American Academy of Pediatrics, which is the national rules and regulations group that governs pediatrics in general, or children's health in general, is really advocating that it's important for kids to go to school, and the danger of kids going to school is minimal compared to the benefits of getting a good education and being around your friends and being socialized. So I think the smart people are really saying it's probably okay to go to school, but we just don't have exact answers to that yet. I think that was kind of all of the questions that popped up here. Hopefully I answered your questions. If you have any other ones, please let your director know and counselors know. They can get them to me. I'm happy to do another video in the future, or I can send you guys an email with answers, whatever works well for you. If you want to do kind of a sit-down Zoom question-answer meeting, I'm happy to do that either on COVID or any other things that you want to talk about. I'd love to see all your faces and see who I'm actually speaking to and who wrote these fantastic questions that I have here. But have a great day. I think most importantly is don't worry too much about this. I know you've all been through a lot. You've all had a lot of things going on in your life, and this is one more big uncertainty. You may have, parents or family members or yourself who are sick, and it's scary to think about them catching something else. And so, we do what we can and do what you can by washing your hands, covering your mouth when you cough, staying away from people. That's going to protect not only you, but it's going to protect all of your family members as well. Okay? So have a good rest of the summer, and I hope to see you soon. Bye.